to an important piece of women's health news, specifically, first, some numbers that deserve our attention and can't be repeated often enough. 2 out of 3 women who die suddenly of coronary heart disease have no previous symptoms, which is all the more reason that women may want to ask their doctors about a blood test that can be a lifesaver. And our chief medical editor, Dr. Nancy Snyderman, is here with us tonight to explain this. Nancy.
Brian, this is not a new test. It's not an experimental test, but nonetheless, it's a test that not a lot of people know about. And that's a problem because this simple blood test could save your life.
Hello. Hi, sweetie.
Today in Atlanta, Ann Dameron Hines is checking in with her cardiologist. She's taking charge after her husband suffered a heart attack in June, making sure she won't be next.
I don't want to be left in the dark. I mean, I've been in the dark, so now it's time to come out of the dark.
I'm going to check it in both arms.
In addition to having her blood pressure and cholesterol checked, she's also getting a blood test for C-Reactive protein, a marker for inflammation and heart disease. As a diabetic who struggles with her weight, Ann knows she's at high risk for a heart attack.
These are all traditional risk factors for heart disease.
But cardiologist Dr. Gina Lundberg says that many women whose doctors tell them they're at low risk may not be.
All too often we see people who've been told they were low risk for heart disease, but they're in the emergency room having a heart attack, so they're clearly not low risk.
And that's because most doctors don't routinely check for C-reactive protein for fear of over-treating people.
Great. Blood pressure's good today.
Dr. Paul Ridker is an expert on C-reactive protein and statins, the commonly used drugs that lower cholesterol.
We've learned that the cost of the screening and the cost of the medication is quite small compared to the number of events prevented. So it's a win-win for everyone involved.
At-risk people can take aspirin and statins to ward off a heart attack.
HDL is a little bit low.
Ann is already on those medications and knows they are only part of the solution. A good diet and exercise are crucial.
Because of the incident my husband had in June, I wanted to be worked up for everything. Going through that kind of a traumatic event, I don't want the family to have to go through that again.
Everyone seems to know about heart disease in men, but doctors still under-recognize the risk of heart disease in women. So this is a reminder. Know your family history, your cholesterol, your blood pressure, and if you're over the age of 40, this is the time to have a conversation with your doctor about this very simple blood test that is reimbursable by most insurance plans.
So C-reactive protein is what to ask for.
CRP.
Okay, now.